Hello, my name is Wade Walker. I'm a staff surgeon here at Alamo Pintado with a special interest in surgical dentistry. And today we're going to talk a little bit about dental health in the horse. Horses are unique in their dental anatomy, very different than humans or dogs. So this is the dental anatomy of the horse, and you can see how long the horse teeth are. But the occlusal or chewing surface is actually quite small, and this tooth will grow down into the mouth throughout the horse's life. This diagram also has cutouts of the sinuses where the teeth grow into. And horses with dental pathology or disease can get sinus disease as well, because the tooth roots actually come into the sinuses. So because of the growth of the tooth, they get sharp points as they grow. And the reason they get sharp points is as they grind, the maxilla or upper arcade is wider than the mandible or the lower arcade. So as they grow, they get points or vampire hooks on the outside of the uppers and on the inside or the lingual, the tongue surface of the lowers. And we have to manage those points, otherwise they'll get ulcers or holes in their gums and won't be able to chew and digest well. So we manage those by doing dental floating, where we trim off the pointy parts or irregular parts of the teeth. In order to do that properly, we need a controlled environment. So typically the horse needs to be sedated, and we use intravenous sedatives to get them calm so we can have a nice evaluation of their mouth. And we use a speculum because they're not going to open their mouth for us. We do it for them with this. And that'll allow an oral exam inside the mouth. And then we use dental floats, and there's two ways to do that. Historically, we're using handheld floats, and we can guide these along the dental occlusal surface or chewing surface of the teeth. Or what I prefer is to use a power float, because I can do a lot more adequate and quicker job with this electronic float along the dental surface of the tooth. And again, our main goal is just taking down those points that cause ulceration of the gums or the tongue, and then any other abnormalities if there's a wave mouth or any abnormal curvature. During this evaluation, we're also looking for things like fractured teeth, bad caries or cavities in the teeth, and other dental diseases horses can get. Because these teeth are continuously growing, it's really important to do dental exams routinely. We're typically doing them at least once a year in normal horses, and the dental floating is done at least every year or every other year, depending on what kind of pathology we have. And because we're doing such a good job managing these horses, both with nutrition, oral care, horses are living a lot longer. And now we're seeing 30, even some 40-year-old horses. And because these teeth continuously grow, sometimes we'll even see a horse outlive the length of its tooth, and it has no more teeth in its 30s or 40s. When that happens, we need a pelleted diet, a partially digested, complete feed, and they can actually eat those without teeth. One other thing to mention is these incisors, the smiley teeth, these really aren't used in the grinding of the horse. That's the molars and premolars back here. So we rarely address these teeth unless they have disease or unless they're slanted, or unless they have a serious overbite or malocclusion. And that's dental anatomy and dental care of the horse. And we look forward to seeing your horses once a year for an oral examination.